Hi, and thank you so much for your interest in doing a metabolic balance program with me. This video will tell you everything that you need to know if you are researching metabolic balance and considering whether it might be suitable for you or not. First of all, I just wanted to let you know why I trained in metabolic balance and became a metabolic balance practitioner myself. When I started out as a practitioner for the first few years, I was finding my job quite frustrating in some situations because I was seeing clients with complicated health conditions or people who were having a lot of difficulty losing weight despite really doing everything right from a conventional perspective, but just not getting results. And I came across Metabolic Balance as a program, and I loved the fact that it was so heavily ingrained in research, that it had a team of professionals behind it, and that the training to become a metabolic balance practitioner was quite extensive. So I spent about 6 months doing my own research, and then I qualified as a practitioner in 2018. So I've been doing the program for about 3 years, and I get amazing results in clinic with this over and over again. I've put over 300 people through metabolic balance now, which is awesome. It really is a true food as medicine approach. So where does metabolic balance come from? It's really important that you understand that metabolic balance is not my program. I did not create this program. This program has far more knowledge behind it than I could possibly give to somebody. It is a German program. It's based on over 20 years of extensive research. What we do is we take somebody's comprehensive blood results, health history, and health conditions, and we send that information over to Germany. And it's in Germany that a metabolic plan is actually formulated. I then receive that metabolic balance plan back, and then I work with you to incorporate that program into your lifestyle. And it's all about finding the right foods for your body to help your body function as well as it possibly can, to minimize inflammation, to reset hormones, and ultimately also to help you lose weight from the perspective of being as healthy as you possibly can. Is metabolic balance for you? It's for everyone, really. I mean, anybody who does the program is going to get really good results, but not everybody needs to do metabolic balance. Before we decide whether metabolic balance is appropriate for you, we do a very comprehensive initial consultation to find out what are you actually trying to address in terms of health symptoms. Do you need to lose any weight? What does healthy look like for you? And what's your lifestyle like? What is your capacity to make changes to your nutrition? Because metabolic balance will dictate to you exactly what foods you need to eat. And for some people that works really well. For others, it's just not going to work in terms of their lifestyle right now. We can decide whether metabolic balance is right for you based on having that initial consultation. Often I'll work with clients for a little while, and then we'll do a metabolic balance program once we've really done some baseline dietary changes. The people that I see really good results with on metabolic balance include people who, for example, are just coming into that menopause state or postmenopause, and they feel like their body just needs a total change, like their body just behaves differently to how it used to behave, and they have to relearn what works for their body. Also have lots of people coming to see me who have tried so many different diets and they just can't lose weight, and they just want to know, what do I need to eat in order to be my best self and find a healthy weight range again? Also, those sorts of health conditions that have really debilitating symptoms, like for example, I've seen fantastic results using a metabolic balance food plan to help ease the pain and the inflammation associated with conditions like endometriosis, autoimmune conditions, any condition that has a lot of inflammation and joint and muscle pain and stiffness. So this is just a little bit of an idea of the kinds of people that respond really well to metabolic balance. But again, an initial consultation together, we can sort of work out whether it's the best course of action for you. How does a metabolic balance plan work? Basically, metabolic balance is a complete program. So we work together for anything from about 3 to 6 months, absolute minimum, and we conduct a metabolic balance program over a minimum of 7 professional consultations. That does not include the very first consultation where we're just kind of getting to know each other and gathering some information and deciding whether metabolic balance is the right route or whether we start with some other option. Once metabolic balance actually starts, once we present a program, the first 4 weeks is very, very strict, and we really have to stick to that program as closely as we possibly can. Before we even get to that point, we also do quite a tough 2-day cleanse, which resets the digestive system, results in a good bowel cleanse, and resets the taste buds. And then as we work together over the months that follow, we're working towards helping you to achieve a healthy weight, helping you to get some relief from your health symptoms, and basically helping you to feel as good as you possibly can. And then working a metabolic balance plan into a livable lifestyle so that you feel confident that you know how to eat moving forward, ideally for the rest of your life, because it's all about getting you off the merry-go-round of dieting and stopping the confusion around food. The investment for metabolic balance with me is $1,350. And that includes the 7 consultations and the food plan, which gets generated in Germany and then sent back to me. In terms of funding, Medicare don't rebate on nutritional consultations. However, if you have private health, Metabolic Balance is a preferred health management plan under Bupa, and many health funds will also rebate on nutritional consultations. However, the total program cost is still $1,350, and then your rebates would come back off that. So just to make it clear, that does include the consultations and the food plan. So if you think metabolic balance is something you're interested in, if you're really serious about finding exactly what foods fit you uniquely, this is the program that does that. I spent a lot of time seeking out metabolic balance for my practice, and I've never seen another program like it. Just book a consultation and we can have a chat and work out where we're going to go to help you as best as we possibly can. If you're a little bit on the fence and you think metabolic balance is something you'd like to do eventually, but you know you need to make some serious changes to your food, I would suggest that you go to our courses website. So courses.thebalancednutritionist.com.au, and you actually check out our Back to Basics course first. Back to Basics is a really good course that you can do at your own pace, and it will set you up for metabolic balance really well because it's still a whole foods program. It's a 3-meal per day program like Metabolic Balance, and we still get some really good results with Back to Basics, even though it doesn't have, the personalized approach so much that Metabolic Balance does offer. Okay, so there's plenty of options there. And hopefully I've answered all your questions. Looking forward to seeing you for a consultation.